1 billion people, more than 15% of the world's population, are people with disabilities, the majority living in low-income countries. International development organizations know that development goals cannot be achieved without addressing the needs of marginalized people. Previously overlooked, the human rights of people with disabilities are being addressed through local advocacy and through national and international channels, such as the USAID Disability Policy and the UN Convention on the Rights of Persons with Disabilities.
The issue of disability is a human rights issue. Now, our country, Ethiopia, ratified UN Convention, and the government admits all parts of that convention. There is no article of the convention left behind. All that convention articles are implemented, maybe for the future. Our hope is the disability is a right issue.
Disability is a development issue. Lack of access to information, programs, services, and opportunities results in poverty, illiteracy, violence, and poor health, and prohibits people with disabilities from contributing to the achievement of development goals.
Disability is both a human as well as a development issue, human rights as well as a development issue, because it's all about human beings. Persons with disabilities are human beings, and things, entitlements that they deserve are human rights.
Disability is a development issue. It's very important to address it alongside of all of our development activities. If we do not acknowledge the needs of people with disabilities within our activities for development in a country, we are not going to be able to achieve our goals of development within the country. People with disabilities in most countries, here in Ethiopia in particular, are some of the more vulnerable people in the country.
Mobility International USA works with development organizations at headquarter and field levels to promote a human rights approach to inclusion of people with disabilities in development. The USAID Disability Policy articulates USAID's commitment to inclusion of people with disabilities in international development. Through the USAID-sponsored Building an Inclusive Development Community project, MIUSA worked with USAID mission offices in 6 countries, including Colombia and Ethiopia, to build partnerships with the disability community and to implement the USAID policy on disability inclusion.
Looking at our entire cycle from when we start designing new projects to how we're implementing our projects, our role in overseeing the implementation with our partners, trainings, everything we have, and really start with that inclusive strategy, which was part of what the BIDC project was doing in USAID Colombia. When it comes to the information we need is realizing this isn't just, okay, we'll provide things if necessary. I think that's sort of the approach we take now because it's easiest, because it's what we're aware of. And again, we're not trying to be discriminatory towards other people. We have the policy that says we'll be inclusive of them, but it has to, you have to be proactive and more than just saying you'll be inclusive, and find ways to encourage people with disabilities to come be involved in all of our programs from the beginning.
Working to ensure inclusion of people with disabilities, USAID staff and partner organizations start with staff commitment and invest in skills building and training on disability inclusion.
We're in the middle of drafting a disability inclusion strategy, which we hope to have finalized in the next couple months and then start implementing.
A very important thing is, getting this thing come up or flare up. Tell them that, here is this issue. You're working on gender. You're talking about pastoralists. So where is disability? Mm-hmm. I think that seed has been planted. Every time I went to visit a child, I would find that they have made a special place for him or her to sit, and you come in and say, there's the disabled child we wanted. Now, that is not what we want. Right. We want them to be a part of the whole group. Mm-hmm. And that took a lot of time.
It's fine to train somebody, like Waleed said, we're increasing awareness, we're training people, we're giving people, the knowledge and awareness, and they're trying, and then they find they lack the skills to actually address the issues that they're facing. They need that to go that next step. It actually needs to come back up to our management team, our director level, so that we're reviewing it and we're all aware of the commitment across all of our platforms, and then we're taking it back then to each of our projects and ensuring and following up and monitoring that those changes are happening.
Outreach and identification are integral to disability inclusion, especially in rural areas. Trainings by disabled leaders are changing community perceptions, attitudes, and practices.
And most of them, they are excluded from this development participation. After this, we are aware that we ask people when we go to the field, to our targeting areas, how many people are here which cannot see, we cannot hear, and we ask them, and why they didn't member of this cooperative. Why? After this awareness, people's trained from here create awareness among the peoples. And before, people's afraid to tell their child or their family are disabled because they consider it as something which is given by God, and it is shame to tell such and to go to inform these people and to bring them to the public. Nowadays, that is nothing.
ማለት በቃ ቢያንስ በራሳቸው ኮንፊደንስ እና ትንሽ ደግሞ የሆነ አመለካከቴ በቃ የሆነ ሊሰሩ እንደማይችሉ ነበር ማለት ነው። ከዚህ በኋላ ግን ያለኝ አመለካከት በጣም ተለውጧል። አሁን ማሰው በቃ ባለኝ አጋጣሚና ባገኘሁት ሁኔታ ላይ ባገኘሁት ቦታ ላይ ለአካል ጉዳተኞች ማድረግ ያለብኝን ነገር ማድረግ እንደምችል
When they design their project, they should specifically set the number as well as the benefits that should goes toward the disabled people.
Director-level commitment to disability inclusion is vital, whether the development issue is emergency response, HIV/AIDS, or internal displacement.
I mean, seriously, I think it's an issue that we have to push to be included. I mean, it is part of our responsibilities. And in fact, in the populations that we work with, we find people with disabilities, especially the ones that were mentioned related to psychosocial problems. We are doing a research on victims organization. We will include some questions related to, and then we will try to include which organizations are working really with disabled people, and if they are aware on how they can be included in the law.
Like gender, disability is a cross-cutting issue in all areas of development. Youth leadership, education, health, food security, water and sanitation, livelihoods, emergency response, access to justice, and democracy and governance.
We need to focus in civic society, to empower civil society. We need that people with disability be involved when the decisions makers are. We need to train people to disability to participate. But how the people with disability can participate when they receive training? We need to teach about the convention, about the public policies in each country, but in a simple language that people for any corner in our country understand that they have rights. And also, it's very relevant that donors pushing and pressing the implementing organization to put the disability issues in their agenda. How you know who has the money has the power. It's important that these international NGOs or local NGOs that are working in development issues work together with the organizations of DPOs, people with disabilities, because it's important that you have the perspective of the disability from the people that live and know about disability.
To achieve the Millennium Development Goals, we need to reach all people, using nothing less than an inclusive development approach. Are you using tools to build an inclusive development community? Are your facilities accessible? Are your communication strategies and media materials accessible to all? Is your program design taking into account the disabled population? And does your organization have outreach strategies to identify them? Are you collecting data on the numbers of people with disabilities served? Have you consulted with disabled people's organizations? Is inclusion part of your strategy?
We have to work together. Work together, change the world together.